You've read the prompt posted outside of the interview door, had a few moments to gather your thoughts, and now it's time to enter the interview room. Are you prepared? The MMI is a common cause for anxiety among students, so in today's video, we're going to give you an overview of the MMI, discuss the scenarios you can expect to encounter, and give you tips and strategies for ensuring your multiple mini interview is a success. Nadine here with Inspira Advantage, helping students get accepted into medical school and other professional programs. Before we jump in, make sure you subscribe to our channel for more tips and strategies to help you along the admissions process. Let's start with an overview of the MMI. The MMI, known as the Multiple Mini Interview, was pioneered by McMaster University in Canada in 2002 and has since been adopted by many North American medical schools. Unlike a traditional question-based interview, during the MMI, you'll rotate through stations, each with a different interviewer and a question, prompt, or scenario to tackle. Most medical schools use between 6 to 10 stations, but some schools may have more stations while others may have fewer. Some schools use a hybrid interview model, where you may need to complete an MMI in conjunction with another interview style. The time you have at each station may vary, but you're typically given prep time to consider the question or prompt, and then 5 to 8 minutes to work through your solution. MMI stations can vary greatly. There's no such thing as a standard rotation, although there are many common types of station. For example, you might need to act out a scene with an interviewer or other applicants, work as a team to work towards a common goal, explain your thought process about a situation with ethical implications, or you might need to answer questions that could pop up in a traditional interview. So questions such as, why do you want to go to this school and why do you want to become a doctor? Let's move right along to how you will be evaluated. So the MMI is used to evaluate a variety of soft skills and qualities required of a great physician. Here are the main areas you can expect to be evaluated based on. Number 1, communication skills. Interviewers want to see how you interact with others, something that can't be effectively measured in a traditional interview. So the MMI will be assessing you on the strength of your oral communication, everything from how you present yourself and thoughts to how well you give instructions to others. Number 2, teamwork. This is a really big one. Many MMI stations require teamwork. Interviewers want to see that you can work well with others, so always be mindful of how you interact with everyone on the day of your interview. Number 3, critical thinking. You'll want to show off your critical thinking skills through detailed and thoughtful answers. Number 4, adaptability. This is a trait that many great physicians share, the ability to adapt to any situation. Think about it. When you show up to work years from now as a practicing physician, you're unlikely to ever have 2 days that are exactly the same, no matter what specialty you eventually choose. And number 5, resilience. You want to be able to show that you can handle the pressure of the task. Now, let's discuss some common scenarios that you'll be likely to encounter. Firstly, scenarios where you interact with others through acting. Now, you don't have to be a Broadway star here, but you do want to showcase your compassion and understanding of the situation. Ask thoughtful questions to the actor to keep the scene going. Number 2, essay writing. Don't sacrifice quality and format here, even though you're under a strict time constraint. They do typically give you a little bit more time for these types of stations, and they're typically formatted like an academic essay. So an intro that doesn't explicitly restate the prompt, but instead builds on it, a body and a conclusion. 3, a standard interview station. So this could be a short snippet from a traditional interview. So you might have to answer a question such as, why our school, or why medicine, or tell me about yourself. Number 4, the team working station. The thing with teamwork stations is sometimes candidates get wrapped up in only trying to complete the task. The secret? The task doesn't really matter. How you interact with others and your compassion and communication does. Number 5, ethics and policy questions. When answering these, make sure you consider the prompt from all sides and think about all implications. Number 6, rest station. This is pretty self-explanatory. Enjoy the break. Take this as an opportunity to talk with other applicants, of course in a friendly and respectful way if you have others joining you. And then number 7, outlandish stations. So these are really hard to prepare for, but try to give a really comprehensive overview of something that shows equality. So you could be presented with a question that asks you which animal you would choose to be. So perhaps you want to be a dog because you value adventure, loyalty, and compassion. Maybe you'd prefer to be a horse because they're reliable, they're strong, and they're adaptable. You want to make sure that your answers are of course more fleshed out than these, but it's important to provide that context and always be addressing the why. Now that you know more about the MMI, let me leave you with some top tips to help you ace your interview. Number 1, never neglect anyone's point of view in a station. So you always want to consider all sides and consequences. Remember to walk your interviewer through these as well. What you see isn't always all there is. Always be thinking, what information is missing? For example, if you're asked about which patient you treat first based on age only after a car accident, you want to consider everything. What is the condition of each patient? Are there more staff available, or is it just you? Be sure to state these questions to your interviewer. They'll want to know that you consider this missing information. So always be sure to walk the interviewer through your considerations of the consequences and parties affected, because they really want to see your thought process here. Number 2, show your compassion and empathy in each scenario before making your decision. And again, make sure you walk your interviewer through this. So for example, if you have a disagreement with your supervisor where they raise their voice at you, try to empathize with them. Are they having a hard day? Are they under a lot of stress? Are they frustrated with a decision that you made? And number 3, the final tip is to practice. You need to get comfortable talking about a topic for 5 to 8 minutes straight. That's gonna feel unnatural at the beginning, especially if you haven't practiced, but you definitely don't wanna finish off your answer in only 1 minute. So you wanna practice using prompts, questions, and scenarios. Some of them could even pop up in your MMI. For the absolute best practice, you should consider participating in mock interviews. This is really the best prep method because it's as close as you can get to the real MMI. You'll also receive custom advice from someone who has coached multiple successful applicants, which can help you position yourself as the best candidate in an MMI interview. Receiving this concrete feedback is really important. Do you slouch? Do you not make enough eye contact? Is your tone too conversational? Your interviewer can pick out your improvement areas and give you the feedback you need to improve. All right, that's a wrap. Thanks for tuning into this video. Make sure you subscribe to our channel for all the latest and greatest on the med school application process. Cheers to your success.